Imagine waking up and noticing a slight yellowish tint to your skin, swollen feet, or even your nails turning completely white. These may seem like small issues, but they could be your body's warning signs of something much more serious: liver damage. The liver plays a crucial role in detoxifying harmful substances and supporting digestion. Yet liver disease is shockingly common, affecting over 25% of the global population. The biggest concern? Many people don't even realize they have liver damage until it's too late. In this video, we're revealing 12 surprising and often overlooked signs of liver damage you shouldn't ignore. Some of these symptoms may even catch you off guard. If you recognize any of these warning signs in yourself, it could be time to act. Stick around till the end to learn how to identify these early warning signs and take action to protect your liver. And if you find this video helpful, don't forget to hit like and subscribe for more life-saving health tips. The liver is a powerhouse organ that plays a vital role in keeping your body healthy. It detoxifies harmful substances, helps digest food, stores energy, and regulates important processes like hormone production. But when it's under stress or damaged, it can struggle to perform these functions properly. Liver damage can happen for many reasons, including excessive alcohol use, poor diet, viral infections, or even certain medications. Unfortunately, liver problems often don't show obvious symptoms until they're advanced. That's why it's crucial to pay attention to the early warning signs. Now let's dive into the 12 weird yet critical signs that could mean your liver is in trouble. One of the liver's key jobs is producing bile, a substance that helps digest fats and gives your stool its typical brown color. If you notice your stool turning pale, clay-colored, or even floating in the water, it could be a red flag that something's wrong with your liver. This change in stool color often happens when bile flow is disrupted, which can occur due to conditions like fatty liver disease or blockages in the bile ducts. When the liver can't produce or release enough bile, waste products in the digestive system aren't broken down properly, leading to unusual stool colors. While pale stools on their own may not be alarming, if you notice this along with other symptoms like abdominal pain or fatigue, it's definitely worth getting checked out. Struggling to see clearly at night or having trouble adjusting to dimly lit areas might seem like a minor inconvenience, but it could actually be a sign of liver trouble. Your liver plays a key role in processing and storing vitamin A, which is essential for maintaining healthy vision, especially in low-light conditions. When your liver is damaged or not functioning properly, it may not be able to store or release enough vitamin A, leading to a deficiency. This deficiency can cause night blindness, where it's harder to see in the dark, as well as dry or irritated eyes. If you've noticed that you're having trouble seeing in the dark, it's important to pay attention to your liver health. This could be an early warning sign that your liver is struggling to keep your body in balance. If you suddenly notice unexplained swelling in your right foot or ankle, it could be more than just a temporary issue. It might be a warning sign of liver problems. The liver plays a key role in maintaining fluid balance in the body, and when it becomes damaged, it can disrupt normal blood flow. This disruption often leads to fluid retention, particularly in the lower extremities, like your feet and ankles. If you notice that your foot is swollen and pressing on the area leaves an indentation, a condition known as pitting edema, it's a sign that excess fluid is building up in your tissues. While occasional swelling can happen for many reasons, if it becomes persistent or is accompanied by other symptoms like fatigue or jaundice, it's worth considering that your liver might not be functioning as it should. If you notice small white or yellowish bumps around your eyelids, it could be a surprising clue that your liver is struggling. These growths, known as xanthelasma, often appear as soft, fatty deposits around the eyes. They can develop when your liver isn't processing cholesterol properly, causing it to build up in the bloodstream. When the liver can't break down fats as it should, cholesterol levels can rise and form these visible growths. While they may not cause pain, they're often a sign of an underlying issue with liver function. If you see these growths, especially if they're accompanied by other symptoms like fatigue or digestive issues, it might be time to take a closer look at your liver health. If you frequently experience discomfort or a feeling of pressure just under your right rib cage, especially after eating, it could be a sign that your liver is under stress. The liver's role in producing bile is essential for digestion, but when it becomes damaged, bile can thicken and turn into sludge. This causes congestion in the gallbladder, leading to pain and discomfort in the upper abdomen, particularly on the right side. In some cases, the pain can even radiate to the right shoulder, as the liver and gallbladder are closely connected. If this discomfort is persistent or worsens after meals, it's a good idea to check in with a healthcare professional, as it may indicate that your liver is struggling to function properly. Your liver is essential for producing proteins that help your blood clot properly. When the liver is damaged, it struggles to make enough of these clotting proteins, which can lead to unusual symptoms like easy bruising or the appearance of red or purple spots on your skin. These spots, known as petechiae, often show up on your legs, arms, or torso and may look like tiny pinpricks. Since your blood is more prone to leaking from small vessels under the skin, you may also notice unexplained bruising or darker areas of skin that don't seem to heal as quickly. If you begin to see these spots regularly or in combination with other liver-related symptoms, it's a strong signal that your liver's ability to function properly is compromised and should be evaluated by a doctor. Real quick, if you're looking to improve your overall health and shed some belly fat without having to exercise, I've got something just for you. My free ebook, Flat Belly Formula: Diet-Driven Secrets for Losing Weight Without Exercise, is packed with simple, effective diet tips that can help you lose weight, boost your energy, and start feeling your best without spending hours in the gym. Click the link in the description to download it now and get started on your transformation. If you've noticed your heels becoming dry, rough, or even cracking, it could be a sign that your liver isn't functioning as it should. The liver plays an important role in processing nutrients, including vitamin B3, which is essential for maintaining healthy skin. When your liver is damaged, it often redirects the available vitamin B3 to repair internal tissues, leaving less for skin health. As a result, you may experience dry, cracked skin, particularly on your feet and heels. These cracks can be painful and prone to infection, which can worsen if not treated. If you're dealing with persistent dry skin, despite proper hydration and skin care, it could be an indicator that your liver needs attention. If you've been experiencing an uncontrollable urge to scratch your palms, the soles of your feet, or other areas of your body, it could be a sign that your liver is in trouble. When the liver is damaged, it struggles to process bile acids properly, causing them to build up in the bloodstream. This accumulation of bile acids can then settle under the skin, triggering an allergic-like reaction that results in intense itching. This type of itching, known as pruritus, is often persistent and can worsen at night. It's important to note that the itching typically doesn't come with any visible rash, which can make it hard to diagnose. If you're constantly itching, particularly along with other symptoms like jaundice or unexplained fatigue, it's a good idea to have your liver function checked. If you've noticed your nails losing their natural pink color and turning completely white or developing a rounded bulbous shape, this could be a concerning sign of liver disease. Healthy nails typically have a pinkish hue, but when the liver is severely damaged, it can affect blood flow and nutrient delivery to your extremities, leading to changes in nail appearance. All white nails, also known as leukonychia, are often seen in individuals with liver conditions like cirrhosis, with studies showing that up to 8 out of 10 people with severe liver scarring experience this symptom. Another related change is clubbed nails, where the nails become thicker and more rounded, often indicating long-term liver issues or other systemic health problems. If you notice these changes in your nails, especially in combination with other liver-related symptoms, it's important to seek medical advice as soon as possible. Early detection and treatment can help prevent further damage. If you've noticed your urine appearing dark amber, brown, or even cola-like in color, it could be a sign that your liver isn't functioning properly. One of the liver's key roles is breaking down a substance called bilirubin, which is a byproduct of red blood cell breakdown. When the liver is damaged, it may struggle to process bilirubin efficiently, causing it to build up in the bloodstream and be excreted through urine, resulting in its dark color. While dark urine is a common symptom of liver problems, it can also be caused by other factors, such as dehydration or certain medications like antibiotics or birth control pills. However, if your urine consistently appears darker than usual and is accompanied by other signs like jaundice or abdominal discomfort, it's a good idea to have your liver health evaluated. One of the most noticeable signs of liver damage is a yellowish tinge to your skin or the whites of your eyes, a condition known as jaundice. This occurs when the liver is no longer able to filter bilirubin properly, a waste product from the breakdown of red blood cells. When bilirubin builds up in the blood, it causes a yellowish discoloration of the skin and eyes. Jaundice can be a sign of several serious liver conditions, including hepatitis, cirrhosis, or even liver damage caused by certain medications. If you notice your skin or eyes turning yellow, it's a strong indicator that your liver is struggling, and you should seek medical attention as soon as possible. If you've spotted small red dots on your skin with tiny blood vessels branching out in a web-like pattern, these are known as spider veins. While they can appear harmless, they can actually be a sign of liver dysfunction. The liver is responsible for regulating hormone levels in the body, and when it's not functioning properly, it can lead to an imbalance, particularly an increase in estrogen levels. Elevated estrogen levels can weaken blood vessels, causing them to break and form visible spider-like veins, often on the face, chest, or legs. These veins appear as small red or purple spots with fine radiating blood vessels. If you're noticing more spider veins than usual, especially in combination with other liver-related symptoms, it might be time to check your liver health. If you notice any of the symptoms mentioned in this video, it's essential not to ignore them. Your liver plays a critical role in overall health, and early detection of liver issues can make a huge difference in your recovery. The first step is to consult a healthcare professional. A doctor will likely recommend diagnostic tests like an ultrasound or blood test to check your liver's condition and determine the extent of any damage. Getting a proper diagnosis is the first step in addressing liver health, so don't hesitate to reach out to a medical professional if you experience any signs of liver trouble. The good news is that the liver is a remarkable organ with an incredible ability to regenerate. If caught early and with the right lifestyle changes, it's possible to help your liver recover and function more efficiently. Here are some effective ways you can start healing your liver today. A healthy diet is the cornerstone of liver health. Start by cutting back on processed foods, sugars, and alcohol. These can overload the liver and contribute to inflammation and fat buildup. Also, try to avoid starchy flour-based foods like bread, pasta, and soda, as they can spike blood sugar and worsen liver damage. Certain foods are especially beneficial for liver health. Include bitter and sulfur-rich vegetables like garlic, onions, cabbage, broccoli, and Brussels sprouts in your diet. These vegetables support detoxification and help reduce inflammation in the liver. Yes, you read that right. Studies suggest that the polyphenols in coffee and the curcumin in turmeric work together to reduce liver inflammation and scarring. A cup of coffee with a pinch of turmeric could help support liver health while giving you a boost of energy. Intermittent fasting, such as eating within a 6-hour window and fasting for the remaining 18 hours, allows your liver to rest and regenerate. This practice helps the liver detoxify, repair, and optimize its functions. Always check with your doctor before starting fasting, especially if you have underlying health issues. Many processed oils like corn, soybean, and canola oil can cause inflammation and contribute to liver stress. Switch to healthy fats like extra virgin olive oil and coconut oil, which are gentler on the liver and promote better health. As the liver struggles to detoxify, it's sometimes helpful to take purified bile salts or digestive enzymes with ox bile. These supplements can assist in liver detoxification and prevent the formation of gallstones by improving bile flow and digestion. These lifestyle changes can go a long way in supporting your liver's health and helping it regenerate. Your liver works around the clock to keep you healthy, filtering toxins, aiding digestion, and helping with countless essential processes. But when it starts to fail or become damaged, your body sends out warning signals. Recognizing these 12 unusual symptoms early could be the key to preventing more serious liver damage down the road. By staying informed and paying attention to your body's signals, you can take action before the situation becomes critical. If you found this information valuable, don't forget to like this video, share it with someone who could benefit from it, and subscribe for more helpful health tips. Let's work together to keep you on the path to optimal health. If you want to learn more about how to keep your organs healthy, watch this next video.